Hey, babe. What are you doing?
Huh?
Where's the food?
I ate it.
Babe, you ate the whole thing all by yourself? I just made this.
Oh! Oh!
You okay?
I think I ate too much. Ooh.
Yeah, I think so too.
Got
So-
heartburn.
Yeah.
Ow.
Unfortunately, this is one of the conditions that affect so many people in America. This is why today we want to talk about acid reflux. Stay tuned. Today we are talking about acid reflux, also known as heartburn, and GERD, gastroesophageal reflux disease. So this is a very common condition, and basically the stats tell us that about 25 to 40% of all Americans are affected by it. So, and I'm sure that you have experienced it in the past. You know, you eat and then you have that burning sensation in your stomach. For some people, maybe once or twice a year. For others, it's like almost every day. So it's very important to talk about it, especially as you are aging, your risk factor increases. So we're gonna give you a few tips today to help you naturally prevent heartburn from happening. So let's first start by talking about the physiology of the stomach. What happens when we eat?
All right, so when we eat, picture this. This is, your head is up here. Can you see my hand? Up here. And then your mouth, you know, the swallowing process takes part, your tongue, and then it travels down into this long tube. This is called your esophagus. The food travels and passes. What we see here is called the esophageal sphincter. Yeah. And this is your, the green is your diaphragm. So the food goes into the stomach and continues the digestion process. So the problem with reflux and the worst part leading to GERD is that this little sphincter right here, there's a delay in closing. So the gastric acid travels up here, and the lining of the esophagus is different from the lining of the stomach, and therefore it causes havoc on what we call reflux, heartburn, GERD.
Yeah. So what are the signs of really of GERD or heartburn? What are the signs?
A lot of them are, again, heartburn, this sensation of like hotness going from your chest even to your throat.
Yeah, like you said, sometimes you can feel it up here. You feel the acidity or the bitterness right up down your throat. So this is an indication that you are experiencing heartburn.
Other things like belching, burping a lot, feeling bloating, feeling very gassy.
You can even have difficulty swallowing or dry mouth. All these things, they are symptoms of GERD. And probably the worst ones are bloody vomiting or black stools. You know, you start throwing up and you see blood in while you are vomiting, or when you go to move your bowels, you're looking at your stool and it's black and hard. These are signs that you're bleeding from the inside, and you need to contact your physician right away. And one of the biggest complications is esophageal cancer. According to the American Cancer Society, about 17,000 new cases are diagnosed every year.
And 16,000 deaths per year due to cancer.
So it kills a lot of people. And you don't want to be a victim of that. So you need to start taking care of your stomach. And we're going to show you how. But before we get into that, let's talk a little bit about the causes. Why do we feel that burning sensation? So there are different causes. So go on, let's go to a few.
Okay. So a cause would be a hiatal hernia. So what that is the stomach, you see between that space right here, between where the diaphragm is, sometimes the stomach can herniate, meaning it goes around the esophagus, causing the sphincter to be open and causes the gastric content, the acid going up into your esophagus.
And she just destroyed my artwork.
Next cause will be pregnancy. You know, as a fetus is growing, it pushes everything up, so it crunches the stomach. Again, it makes this little valve here very leaky. So again, the gastric content goes up.
So for you men here, you may be smiling because you don't get pregnant, but big belly also is a cause that can it can cause hiatal hernia. So if you are overweight, you are obese, then that can cause you to have heartburn. And they found that the bigger you are, the greater your risk to develop GERD.
You mentioned aging. As you get older, again, the organs don't function very well as you were younger, so that's an increased cause or increased risk of heartburn.
Eating a lot, eating large meals, that definitely is a cause of heartburn. Because as you eat and you eat too much, then that prevents the sphincter from closing, and the acid find a way to go up to the esophagus.
Chronic cough, again, you're building pressure from your abdomen, causes a leaky valve.
Some medication and supplements also can cause you to have heartburn. So you need to read your labels, right? Know what you're taking, look at the side effects, and if while you're taking medication you start feeling that sensation, then you might want to discuss that with your healthcare provider. I think we covered the most important ones. You can find more on the link that we're going to be posting. If you're watching, if you're not watching our video on YouTube, please go to our YouTube channel and you can see more links that can give you more information about this. So let's get into remedies. Let's give you a few tips to help you with this. Let me ask you something, Camille. Are you looking at the camera? Where is your belly? Do you have pain? If you eat a lot, what would happen? Alright, so our first tip is, of course, diet. Most of the time, we suffer from heartburn is because of the type of food that we eat. So we need to look at them carefully. So things that you can eat, that we encourage you to eat, is unprocessed food. You know, get your raw salad, vegetables. These unprocessed food will be good for you and help you avoid heartburn.
Another one we suggest is high fiber diet. Anything white, remove, like white rice, white sugar, white flour. You want to decrease or eliminate these from your diet.
Avoid sugar, and sugar is make your stomach very acidic, so you want to stay away from it, especially the refined sugar. Stay away from that.
Carbonated beverages. If you're a soda drinker, multiple cans a day, you want to cut that out of your diet.
Excess proteins. Whether you are taking a lot of protein that you are buying at the store, for exercise purposes, or a lot of protein in meat and milk, you need to cut down on that. Cut down, because these things also, they are very acidic. They will make your stomach burn. And
avoiding fried and spicy food. That definitely gives you a risk for heartburn.
So, and you can add some probiotics to your diet. That will help also reduce the risk of developing acid reflux.
So some other tips we have for you is chew well. Don't overeat. They say chew because digestion starts in your mouth. So the finer your food is, by the time it hits the stomach, it's less work for the stomach, less work for the Finster valve.
And of course, don't overeat. Learn to control yourself. And a good way to help you with that is to eat your salad first.
Or drink water first, so that your belly feels full, so you eat less of the cooked food.
Exactly.
Also, only drink almond milk. My favorite.
All right.
Fasting.
Fasting is a very important one. And as I'm saying that, I know that most of you can't go 3 hours without eating. Some people can. But fasting is very important. It's very important that you give your stomach a rest. Every now and then, maybe every couple of months, okay? Take a day off from food. You won't die. I'm telling you, you will be alive the next day. All right? And number 4, eat about 3 hours before bed. So this is very important because a lot of people, they like to eat in bed. And I can tell you that a lot of my patients, they like to eat in bed. So they just eat their food and bring their head down and go to sleep. So when you got to look at the shape of the stomach, you see the way it is, it's coming. So you got the stomach going from this way here and go here. So if you go and you eat and you lay down, then the food is backing up and it's gonna force open the sphincter and gonna burn your esophagus. So please, when you're eating, eat at least 3 hours before you go to bed.
And the last 2 tips is exercise. Manage your stress. Stress does cause acid reflux. And avoiding alcohol, caffeinated drinks, and smoking.
So these are our tips for you. We want to just to add as a bonus a few natural remedies that you can add to help you out if you're already suffering from heartburn.
So before we do the natural remedies, what does the so we have 3 medications that people who suffer from heartburns are usually prescribed, and we gotta I would advise not to just jump on those 3 medications, because acid in your stomach, there's a reason why it is there. It is there to digest your food. It is there to kill bacteria. And so when you take this medication that tells your stomach not to make acid, think about the issues, the health problems it brings. It means that the food that you eat are not being digested, so it travels, it passes your stomach, it goes to your intestine, and your intestine sometimes doesn't have the function to break down the food that the stomach does. So you get constipation, you get bacteria growth in your GI system, you get malabsorption. When you eat the nutrients in the food, you can't absorb it, so therefore you feel weak, you get anemic, and a slew of health problems that comes along with it. So be careful. Do your research, please. Do the link, because the link we have our sources that does break down the cons on those 3 medications that a doctor would most likely prescribe you if you have acid reflux. So just keep that in mind. So as we know, this is well-being makes sense. We want to give you a natural way to treat your symptoms, and let's go to our kitchen. So what can you do to help your symptoms? Okay. Personally, when I go to a restaurant, I always say, give me water with no ice with some lemon. And I drink the water before I eat, and after I eat, I drink a couple of more sips. So lemon, it's very good in terms of reducing the acidic symptoms that you have. Natural things as well. Apple cider vinegar does wonders for those who suffer from heartburn. Natural ginger, I don't know if you can see it. Ginger is one thing that should be found in your kitchen to help you with your symptoms. Having chamomile, this is the natural. You just diffuse it in your tea bag along with your mint leaves. These are natural supplements that your body and your stomach will give you a healthy stomach. And for our natural sweetener, honey, again, it has the antibiotic properties that will give you a healthy stomach. And last but not least, garlic. We had a session about garlic. Check it out on hypertension. And this too, if you suffer from heartburn, from constant nausea, you warm it up in some water and you drink that. You drink the water. That also give you a healthy gut.
And don't forget, you can always make tea with honey.
Yeah, that is true. Thank you, Kami.
We hope that you learn from this video and that you're gonna practice these things, because our goal is for you to live a healthy lifestyle. So until next time, bye.
See you later. Comments in the Give us in the comments.
Thank you.